USMLE-style questions focused on mediastinal lymph nodes, their drainage, trachea, esophagus, and associated pathologies like pulmonary TB, sarcoidosis, and lung cancer. Question 1. A 30-year-old woman presents with progressive shortness of breath and dry cough. A chest X-ray shows bilateral hilar lymphadenopathy. Biopsy of a lymph node reveals non-caseating granulomas. Which of the following is the most likely diagnosis? A. Pulmonary tuberculosis. B. Sarcoidosis. C. Lung adenocarcinoma. D. Histoplasmosis. E. Silicosis. Correct answer B. Sarcoidosis. Sarcoidosis classically presents with bilateral hilar lymphadenopathy and non-caseating granulomas involving mediastinal and hilar lymph nodes. Why not the others? TB equals caseating granulomas, usually unilateral hilar adenopathy. C. Lung cancer typically causes unilateral lymph node enlargement. D. Histoplasmosis equals can mimic TB but usually caseating granulomas. E. Silicosis, upper lobe nodules, eggshell calcified hilar nodes, not bilateral symmetrical adenopathy with non-caseating granulomas. Question 2. A 55-year-old man with a history of smoking presents with cough, hemoptysis, and weight loss. CT scan reveals a mass in the right lung and right hilar lymphadenopathy. Which structure is most likely to be involved in lymphatic spread of this malignancy? A. Axillary lymph nodes. B. Cervical lymph nodes. C. Mediastinal lymph nodes. D. Inguinal lymph nodes. E. Mesenteric lymph nodes. Correct answer C. Mediastinal lymph nodes. Lung cancer commonly spreads first to hilar and mediastinal lymph nodes, especially those draining the trachea and bronchi. Why not the others? A. Axillary, drains upper limbs, not thorax. B. Cervical, possible in advanced disease but not first involved. D and E. Inguinal and mesenteric, drain lower body and gut. Question 3. A 40-year-old man from Mexico presents with fever, night sweats, weight loss, and productive cough. Chest X-ray shows right-sided hilar lymphadenopathy. Sputum is positive for acid-fast bacilli. Which of the following best describes the most likely pathologic feature in his hilar lymph nodes? A. Lymphocytic infiltration without granulomas. B. Non-caseating granulomas. C. Reactive follicular hyperplasia. D. Caseating granulomas. E. Amyloid deposition. Correct answer D. Caseating granulomas, pulmonary TB causes caseating granulomatous inflammation in hilar and mediastinal lymph nodes. Why not the others? A. Incorrect. TB involves granulomas. B. Non-caseating sarcoidosis. C. Reactive hyperplasia, viral infections. E. Amyloid, unrelated to TB.